I think that we have to, of course, keep in mind that this data is from a retrospective analysis. So there is a significant, of course, caveat involved that there are sort of inherent limitations to this analysis, and we have to consider these data and these outcomes really in that context. However, having said that, I do think that this study actually sheds very important light on a topic where previously there hasn't been as much published, and that's specific biomarkers from next generation sequencing panels that suggest potentially better or inferior outcomes with Enfortumab vedotin treatment. And of course, we can potentially use some of this data in everyday clinical practice, but I think we should be careful about that and really use it in the context of other clinical data that we have available. But with that, I would say that this biomarker analysis data from the UNITE study can help inform both clinical decision-making as well as the potential sequencing of therapies, so indicating which patients we should prioritize Enfortumab vedotin for, maybe as opposed to other drugs. But again, taken in the broader sort of clinical context and looking at all the other patient and treatment-specific factors. And then I think it also may inform future clinical trial design as well. But I highlight that this retrospective data should be validated prospectively, but provide some very important hypothesis generating results.